More than that, they get to tell the story of the biggest game of all.
When life throws you a curveball, it can feel like you have no control over what happens next. And if that curveball comes in the form of an injury, a painful recovery seems pretty much inevitable. With iovera, you can control what happens next. Clinical studies have revealed significantly better outcomes for patients who receive iovera treatment prior to surgery. They requested fewer opioid prescriptions, experienced less pain, and were discharged from hospital sooner than those who received standard of care treatment. So, how does it work? It's simple. Focused cold therapy is delivered direct to the nerve via a closed-end needle contained within a small handheld device. And a cold zone is formed under the skin, stopping the nerve from sending pain signals until it regenerates up to 12 weeks later. Ask your healthcare provider about iovera.